Fife's British Sign Language Plan. British Sign Language Outcomes 2018 to 2024. Outcome 1. Scottish Public Services. We share the long-term goal for all Scottish public services set out in the BSL National Plan, which is: across the Scottish public sector, information and services will be accessible to BSL users. By 2024, the actions we will take in Fife are: Reference 1.1. Actions. Analyse existing evidence we have about BSL users in our organisation. Identify and fill key information gaps so that we can establish baselines and measure our progress. Measure. Report produced detailing current situation. Accountability. All partners. Reference 1.2. Actions. Improve access to our information and services for BSL users, including making our website more accessible to BSL users. Measure. Audit of evidence of information being available in BSL. Accountability. All partners. Reference 1.3. Actions. Promote the use of the Scottish Government's nationally funded BSL online interpreting video relay services called Contact Scotland BSL to staff and to local BSL users. This is a free service which allows BSL users to contact public and their sector services and for these services to contact them. Measure. Number of BSL users registered with Contact Scotland BSL. Accountability. All partners. Reference 1.4. Actions. Information on council services will be provided in BSL on request. Measure. Number of BSL users requesting their preferred format. Accountability. All partners. Reference 1.5. Actions. NHS Fife and Fife's Health and Social Care Partnership to undertake communication support for service users and support implementation with BSL user involvement. Measure. Number of service users utilising services from the Health and Social Care Partnership. Uptake from service users completing registration forms for shared data across the Health and Social Care Partnership. Increase the number of service users accessing communication support across the Health and Social Care Partnership. Number of complaints or positive feedback raised about BSL provision across health and social care and NHS acute services. Accountability, NHS Fife and the Deaf Communication Service. Reference 1.6. Actions. Provide training to staff in Fife Council and external agencies who work with BSL users around deaf awareness and culture training and BSL taster sessions. Measure. The number of staff trained and outcomes of training reported. Accountability, the Deaf Communication Service. Reference 1.7. Actions. Provide BSL tuition and support to families to enhance communication between parents, siblings and wider family members. The measure. Number of training courses delivered and number of people who have attended courses. Accountability, the Deaf Communication Service. Reference 1.8. Actions. Work with early years, schools and colleges around making information accessible to BSL users. The measure: range of information available in BSL. Accountability: Deaf Communication Service, SRUC, Fife College. Reference 1.9. Actions: work within the Health and Social Care Partnership, providing training to staff around accessible information for BSL users, including health information. Measure: number of people who have attended training and reported outcomes. Accountability: NHS Fife, Deaf Communication Service. Reference 1.10. Actions: work with BSL users to improve web-based access to a wide range of council services by filming relevant video clips in BSL. Measure: number of complaints, positive feedback with regard to access. Accountability: Deaf Communication Service. Reference 1.11. Actions: provide and promote communication support for all Fife Council services and external agencies who require registered BSL interpreters, tactile BSL hands-on interpreters, deafblind manual interpreters, and lip speakers with signed input. Measure: details of what action that has been taken to promote support. Feedback from people who use BSL if this has improved their experience of receiving appropriate support. Accountability: Deaf Communication Service. Reference 1.12. Actions: ensure employment agencies are aware of access to work in supporting BSL users into employment. Measure: details of action taken to raise awareness of access to work and outcomes reported. Accountability: Opportunities Fife, Health and Disability Delivery Group. Reference 1.13. Actions: promote text service and SMS to BSL users to have urgent letters translated. Measure: increase in use of SMS with DCS. Accountability: Deaf Communication Service. Reference 1.14. Actions: review drop-in service to take account of BSL user needs in Fife. Measure: number of BSL users requesting drop-in service. Accountability: Deaf Communication Service.